Insomnia is one of the most common sleep disorders, with nearly one-third of the United States population reporting symptoms each year. It is defined as having difficulty falling asleep and maintaining that sleep. People with insomnia may have trouble falling asleep. They may wake up regularly throughout the night, and they simply just may not feel rested the next day, which means they do not get a restorative sleep. Insomnia tends to accompany many medical and psychological disorders. It can even be related to issues with your biological clock and its control of your body temperature. Drug use has also been known to cause insomnia, as well as environmental factors such as noise, light, and room temperature. People who have had a drastic change in their routine, as well as students who are under a lot of stress, tend to suffer from insomnia. The biological theory is the main theory among professionals regarding insomnia. According to this theory, people may be biologically vulnerable to insomnia. They may have a family history of insomnia and other sleep disorders. This biological vulnerability can interact with sleep stress, which in turn can make for poor bedtime habits and other things that affect physiological activity of sleep. Doctors often prescribe medications for sufferers of insomnia that can be either short-acting or long-acting. Short-acting drugs are generally preferred due to the tendency of long-acting drugs to work well into the morning and cause excessive daytime sleepiness. Some medications work directly through the melatonin system to help people fall and stay asleep throughout the night. A few drawbacks of these drugs include excessive sleepiness, patient dependency, and increased sleepwalking-related disorders. Some professionals suggest that patients try phototherapy. This involves the person being seated in front of a bank of fluorescent lamps that generate an extremely bright light. This procedure is used to help people with sleep schedule-related insomnia. Relaxation treatments are used to ease physical tension that can sometimes cause insomnia. Cognitive treatments have also been used for people who complain about work anxiety, relationships, and other at-home situations that cause them to lose sleep. Stimulus control has also been known to be very effective. For example, a student may be instructed not to do any homework in bed. They are to use their bed for sleeping and nothing else. This associates the bed with rest and should help reinstate their sleep schedule. Insomnia is an extremely common and completely treatable psychological disorder. In most cases, the person suffers from some sort of sleep deprivation. This may be caused by many factors, including cognitive issues, environmental aspects, or personal choices. Many professionals believe it can even be inherited. Those who suffer from insomnia have many choices when it comes to a method of treatment. They may go the medical, environmental, or psychological route. All in all, insomnia is entirely curable and no one should have to suffer from its ill effects.